So for this video, we're looking at two tests that help us in our assessment of the ulnar nerve, specifically if we're having more neurologic symptoms. And so those would be things like numbness, tingling, a burning sensation in and around the orientation or the path of the ulnar nerve. The first that we're going to look at is what's known as the elbow flexion test. And the elbow flexion test is specifically a static test that looks at compressive forces in and around those areas that we commonly think as being entrapment sites. And so the position for this is as follows. We're going to ask our individual to fully flex their elbow. From here, they're going to fully extend their wrists. So what we're doing is we're getting at the entrapment site at the elbow on the medial side. We're also getting at kind of our tunnel of Guyon or Guyon's canal at the wrist by going into full wrist extension. Finally, we're going to ask them to abduct the shoulders and kind of scapular squeeze. Now, this test was defined as being held for 3 to 5 minutes initially. That's quite long for most of your patients. And if they do have a real ulnar kind of nerve pathology or even lesion, they'll oftentimes get symptom reproduction within about 60 to 90 seconds. Though, if you suspect this based on clinical reasoning and you're not getting reproduction of symptoms, you may choose to hold it for a longer period of time. Additionally, make sure that you're being specific to the ulnar nerve in terms of innervation. If they're getting numbness and tingling more through kind of the wrist and hand down into the first CMC and second and third digits, that's not the ulnar nerve distribution. And so that would then be considered a negative, even though they are getting a paresthesia-like sensation. You're specifically looking for sensory changes through the hypothenar eminence into the fourth and fifth digits. Go ahead and relax. So there's our ulnar flexion test. The second test is what's known as Tinels. Now, Tinels is used in a variety of locations throughout the body. And in essence, all Tinels is a tapping of a nerve as it passes through a potential site of compression. So we see Tinels at the elbow, we see Tinels at the wrist and hand associated with the median nerve, we see Tinels at the foot and ankle associated with the tarsal tunnel. And so Tinels can be used anywhere. In essence, you're trying to create a little bit of a compressive force on that nerve to see if their symptoms reproduce. So for Tinels, it can be done in seated or in a standing position. We're going to bring the individual out. We're going to find our area of potential entrapment here on our medial elbow. And once we're there, we're going to create a tapping sensation. We can either do this with our finger or we can do it with a reflex hammer. From there, you're going to assess for the reproduction of the symptoms that the individual has been complaining of. Again, much like we saw with the elbow flexion test, if they're getting paresthesias on the more lateral portion of the wrist and hand, that's not considered a positive, right? That would be more radial and medial innervation. We're looking on the more medial side, our fourth and fifth digits for the ulnar nerve. So, you have the elbow flexion test, a static test, and you also have the Tinels sign or Tinels test. Have a go with both of these tests with a peer or colleague, and let me know if there's any questions.